Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jessica Adams. This is one of 6 short episodes taken from a webinar on barriers and solutions to expanding PrEP uptake, featuring Dr. Timothy Wilkin. Dr. Wilkin is a scientific and medical consultant and a professor of medicine in the Division of Infectious Diseases at Weill Cornell Medicine in New York. In this episode, Dr. Wilkin discusses barriers to PrEP uptake for adolescents. For the full online educational program, please visit the link in the show notes for this episode. Now let's get started and hear what Dr. Wilkin has to say about barriers to PrEP uptake for adolescents.
Okay, next we're going to talk about PrEP uptake in adolescents. Adolescents, as we'll learn, make up a large number of new HIV infections, but they are underrepresented in PrEP. And we'll discuss the reasons for this, but it's something to think about at your institution. How do you reach those adolescents that are at risk for HIV infection? How do you offer them and prescribe? How do you offer them PrEP? How do you get the PrEP to them? How do you support them to stay adherent to the PrEP? So PrEP is clearly underutilized in adults and adolescents. So people age 24 or younger accounted for only 14% of PrEP users, but are over 20% of new HIV diagnoses. And of the new HIV diagnoses in the US, 22% of them occurred among adolescents aged 13 to 19. So 85% in male, but 12% of these occurred in cisgender women. And if you look at the race ethnicity for HIV diagnosis among adolescents, you can see that Black and Hispanic adolescents are very overrepresented. It's a lot of disparities in this area that people of color are at much higher risk for HIV infection. So some of the barriers for providing PrEP to adolescents is that many providers are not aware of PrEP or the need to really target young people and adolescents. Some people have discomfort performing sexual histories. If people are seeing pediatricians, the pediatricians may not really be as comfortable or appropriately comfortable with sexual histories and sexual health, and may be uncomfortable to prescribe HIV medications. There may be concerns that patients who receive PrEP will then engage in riskier behaviors. There's really very real legal implications. So all states in the District of Columbia allow people under 18 to consent to STI services. However, there are 18 states that allow providers to inform parents that a minor is receiving STI services. And if these services are billed, and especially if there's medication prescribed, it can be very difficult to guarantee confidentiality when the adolescent is on the parent or guardian's health insurance. So real issues. And then in a review and a meta-analysis of adherence to PrEP in adolescents and young adults, this study included 29 studies with close to 9,000 participants, and the average age in the study was 24. And what they found was that the overall adherence was about 64% across the studies. It was lower in young cisgender women versus young men who have sex with men, but still all of those were much lower than in serodiscordant heterosexual couples, for example. So I would suggest that these adherence rates in both young women and young men who have sex with men are really low, and that degree of adherence or non-adherence might put them at risk for acquiring HIV. So we know that young people report lower levels of medication adherence in general, but some of the barriers specific to PrEP could be adverse events or the fear of adverse events, dissatisfaction with the medical team or a lack of connection with the medical team. There could be forgetting or inconvenience. Some of the executive functioning required for adherence may not really develop fully till the age of 25 or so. There are high rates of depression. There can be social stigma associated with accessing these sexual health services. A lack of support and clearly substance use can complicate all of this. So what can be done? So this was a systematic review of interventions for adolescents to improve medical adherence. And so enhanced and peer-based counseling can help, computer and phone-based counseling, text messages, clinics that are actually set up for adolescents, and really like same-day pill starts. This is a really interesting concept that we now see the benefits of for treating HIV. But when somebody comes to access HIV testing and is found to be living with HIV, actually offering the medication and starting the medications the same day really engages people in care, and people who start the same day actually end up having better, longer term outcomes. Well, there's some evidence that this is the same for PrEP use, and we'll talk about it in relation to adults in a minute. But starting the pills the same day actually really helps people engage in that. Having extended pill supplies so people are not accessing medications every month, and being able to provide the medication outside of medical settings. So we're not going to talk about specific clinical trial data today, but the long-acting injectable PrEP seemed to be particularly useful for adolescents to really help with these issues of adherence. So if you would engage the adolescents to have the long-acting cabotegravir every 2 months, and then between that, you just have to kind of get them into the clinic for the cabotegravir, or in some cases, find them out in the community when they're due for their cabotegravir. And that is also a consideration for how to improve the PrEP uptake in adolescents. So there's multiple technological approaches, mobile apps, electronic PrEP care systems. Some people are accessing their PrEP at home, trying to engage social networks to take up PrEP can help as well. Gamification, a way to kind of make it a little more interesting, of raffles and different things to kind of keep people engaged in their PrEP use.
Thank you very much to Dr. Wilkin, and thank you to our listeners for joining in. As a reminder, to view the full Contemporary HIV Treatment and Prevention 2022 program on the Clinical Care Options website, and to access the slide set, click on the links in the show notes for this episode. Please be sure to check back regularly for more episodes on important infectious disease topics. Thank you, and have a great day.